To put in perspective how successful the U.S. immunization program is, this slide details many of the vaccine-preventable diseases, or in the case of rubella, a complication, the congenital rubella syndrome, representative numbers of cases reported or estimated during generally the pre-vaccine era, sometimes in the vaccine era, but in the 20th century, 2018 cases, and percent decrease. And while we still have some problems, such as with pertussis or whooping cough, you can see here we've had tremendous reductions in our overall immunization program, and we're very proud of that. This is just some other diseases that we routinely vaccinate children in the United States against. We have 16 vaccine-preventable diseases of children in the US that are universally recommended for children in the US. And you can see here, while we haven't done as well with some of them, we still have had marked reductions. Even for rotavirus, we've had over a 50% decrease in hospitalizations. And this has not come easy. This is a very complex program, and there are multiple partners that have been drawn in to work on this. One is academic and other researchers, and these people determine health burdens, who is getting it, who is transmitting it, for whom should vaccine be targeted, and they do the basic research for vaccines, looking at what is a protective immune response and how do you induce it. The vaccine manufacturers are critical because they're the producers, they're the actual innovators. We used to have public government manufacturers that weren't able to keep up, and all of our vaccine manufacturers with a market in the US are private. Policymakers who actually tell us how to use it, the people who actually deliver vaccine, what we call third-party payers to remove financial barriers to access, federal, state, and local governments, political leaders, parents, and many others. And all of these groups need to work together in order to have a successful immunization program. And sometimes that's not realized in many countries around the world. Now, this comes from an article by Jaime Sepulveda, who I mentioned earlier, and which he tried to define vertical, horizontal, and diagonal approaches. And so a vertical approach is a focused, proactive, disease-specific intervention. For example, smallpox eradication was targeted, how do we eradicate smallpox without that much thought about what do we do to build the whole system. In contrast, the horizontal approach is we're not going to look at a specific disease, we're just going to build the system that will deliver all of the vaccines. And we're going to measure all coverage, and we're not going to look at one specific disease to pull us forward. And a diagonal approach is basically taking a disease-specific approach and using that to build the whole system. And as I'll show you, the recognition, measles, because it is an indicator disease, is very helpful because the strategies, for example, to improve routine coverage for measles can be used to improve routine coverage for all vaccines. So it's in essence using a disease-specific approach to pull along the whole system.